Hello, my name is Dr. Leslie Haggerty, and I'm one of the physical therapists here at Oaklawn Hospital that specialize in the treatment of the pelvic floor. Pelvic floor therapy is only done by those who have extended training and skills which can help people with specific problems such as pain with sexual activity, pelvic and abdominal pain, leakage of urine with coughing, sneezing, or lifting, a feeling of a need to urinate frequently or urgently, drooping or descent of the pelvic organs, chronic constipation, or even leaking of stool. The reason a physical therapist can be so helpful is that all of these things are controlled by muscles. Muscles similar to what we have in our arms and legs. When I look at my arm, I can easily see whether my bicep muscle is flexed or relaxed. But because we can't easily see the muscles of the pelvic floor, it is more difficult to know when they are tight, when they are flexed, or when they are relaxed. For normal function, these muscles need to be able to get short or get long. Just like my bicep muscle here in my arm needs to be able to get short or get long for my muscles to work properly. The pelvic floor is a hammock-shaped group of muscles that attach to the pubic bone in front, to the tailbone and back. On the sides, it attaches to these two bones that we sit on. As a group of many small muscles in 4 different layers, these muscles all need to coordinate together to cause closure of the urethra, vagina, and anus, as well as to elevate or lift the pelvic organs upward. If the pelvic floor muscles are weak and cannot flex, then we have problems like urine leaking when we cough, sneeze, or lift. This may be a frequent complaint, especially for women, but it is not normal at any age. Although this sometimes happens after pregnancy, leaking should stop within the first 6 weeks postpartum. Pelvic floor physical therapy can help you to regain control of these muscles so that leaking doesn't happen. Another common problem is that the muscles become too short or tight. People with a pelvic floor that cannot relax sometimes feel like their bladder doesn't empty all the way. They may feel they have to rush to the bathroom to avoid leaking. Perhaps they feel like they need to go more often than every 3 to 4 hours. They may have difficulty passing stool, or need to get out of bed to urinate more than once a night, or they may have pain with intercourse. These muscles can learn how to relax again. A pelvic floor therapist can help to gently relax and lengthen those muscles, and we also love to teach you how to do these techniques on your own body. It is important that if you have a tight pelvic floor, that you try not to do pelvic floor exercises on your own. Pelvic floor exercises known as Kegels, where you flex these muscles on and off, could make that condition worse. But since many people do not know if their muscles are too tight or too loose, be on the lookout for a negative impact from Kegels. If you start Kegels to restore continence and your symptoms get worse, then I suggest stopping Kegels and consulting with a doctor about coming to physical therapy. It is possible to have a combination of these problems. Your pelvic floor needs to have the ability to flex and to relax to have optimal bodily function. Pelvic floor physical therapists can teach you how to do both. The important thing to remember is that none of these problems are normal after any certain age or after having a baby. These are all problems that can successfully be resolved most of the time, or at least considerably improved with pelvic floor rehabilitation. Pelvic floor physical therapy is covered by insurances, but most insurance companies require that you get a physician referral before starting physical therapy. Once you have that, you can call any of our offices to get set up. You can expect our first visit to last about an hour, and then follow-up visits are 45 minutes long. Our clients typically have 1, perhaps 2 follow-up treatments a week, and the length of care is usually around 4 to 6 weeks long. I hope this information was helpful. If you're experiencing symptoms such as those mentioned earlier, we look forward to helping you get back to feeling 100%.